Well, hello, everyone. Welcome to our forum on child care stabilization grants. I'm Donna Wade, and I'm the Senior Program Director at the Early Childhood Investment Corporation here in Michigan. We partner with the Michigan Department of Education to provide guidance and resources for child care providers across the state as they embark on using federal dollars to support their child care programs. Today, we are joined by child care experts from three other states, Maryland, Nevada, and Louisiana. And they're here to share their stories and wisdom on how child care providers in their states have navigated this process. So welcome, guests. So today we have from Nevada, Marty Elquist. She's the program manager at the Children's Cabinet. Welcome, Marty. We also have Margot Chappel from Nevada, and she's the Deputy Administrator, Field Operations Support from the Nevada Department of Health and Human Services.
Did a great job pronouncing my name too. Thank you.
Great, great. And from Maryland, we have Christina, and I'll probably mess up your last name, Push. She's the Executive Director of the Maryland State Child Care Association. And lastly, we have from Louisiana, Ruth Ann Oakley. And Ruth Ann is the Policy Director and General Counsel for Louisiana Policy Institute for Children. Welcome, everyone. Okay, so one of the concerns that we hear from child care providers and policymakers alike is that the American Rescue Fund plan provided this one-time funding. So, we're really grateful. This was a historical investment in early child care, but it is kind of concerning. It's understandably concerning about how much impact can be made from one-time funding. So when you think about your states, what advice do you have for providers who are navigating this crisis with one-time funding? And what message do we have for policymakers as, as you hear from them and as they listen to you, and as they think about making considerable investments to sustain this field?
I'll go first here, and then
Sure.
say what she would like to say. One of the big things that we're using this opportunity for is to increase our rates on a more permanent basis.
Mm-hmm.
We have historically used a scattershot method to serve as many children as we possibly could, but always at a lower percentile of the reimbursement rate. So we are shifting our orientation from that approach to paying at a higher rate, and then we may end up having to have a waiting list, and then we'll go back. Fortunately, we have the support to do this right now, that then we could we would need to go back and say, and we've been successful in other programs at the state level. When we've had a waiting list, we've been able to go back and say, we have a waiting list and we need your help, and we don't have any more federal funding. And our state has reduced since 2008. They've put only $2.5 million of general fund into the child care program. And so we're hopeful. We're requesting to replace the original $10 million in the next legislative session. That was previously an annual infusion of cash into the system. And so hopeful that we can get that again reinstated, and then possibly even more. So Marty, thanks.
Thanks, Margot. I would say to support providers, reiterating that the workforce needs support now. And we did hear some hesitancy for, wage increases. Well, okay, could you do temporary bonuses, and making sure that we coach providers through using very clear messaging for their staff. I think there's this fear to give their workforce something and then to have to take it away, but our message is providers need the support now. They're struggling with transportation and groceries and rent, and anything that you can do to stabilize a workforce who is underappreciated at the moment and underpaid. Our workforce is stressed, and they're caring for children. And when a lot of them have instability in their lives right now through this pandemic. So our message has been anything that you can do to stabilize the lives of caregivers can stabilize the lives of children and families in your care as well. So it's a win-win. Just be clear with the messaging that you're giving to your staff, and be clear that right now this is temporary, but we are working with community and state partners on sustaining funding through avenues such as Margot just explained. And to continue to advocate. Oftentimes when we hear providers lament about, the shoestring budgets that are on even before COVID, we would really strongly encourage them to advocate, and would link them up with, in Nevada, the Children's Advocacy Alliance to give them pathways to become stronger advocates. So Christina, your message from your provider was so powerful. And I think that it's one thing for us to say, what we hear from providers, but to hear it from a provider and a parent, those messages are really, really powerful. So I think another thing we can do is really encourage providers to tell our elected officials how much this funding has meant and what it meant for their operations, allowing working parents to go to work, really connecting the dots from childcare to economic recovery for all of us.
Yes.
And I think that's critical.
I agree. Would anyone else like to comment on that question?
Yeah, I'd like to say that. And I think it's just this whole one-time dollars issue just kind of highlights a conundrum. I mean, obviously, we're so very grateful to have these dollars to secure and stabilize our childcare businesses during like such a critical moment, but it's really difficult to, at the same time, continue that message to policymakers as to why this is so urgently needed, because they aren't really seeing like the full extent of the pain, I think, that would be occurring, but for this one-time money. And it's like, well, if we don't have a plan for when the one-time money is gone, like you'll see it then. And so I think it's just, I'm reiterating the same things that we try to like make policymakers understand, that there's a tremendous return on investment when we invest in our youngest learners, and that not just for children and families, but also for our businesses. Our economy cannot function without childcare. Our state's done economic analysis on it. Louisiana loses $1.3 billion every year just due to childcare breakdowns. And the U.S. Chamber of Commerce has replicated that study in multiple other states. You find the same thing every single time. Millions and billions of dollars of value lost just because parents cannot afford or cannot access reliable quality care for their children. These one-time dollars are kind of offsetting some of those realities now, but they still are the realities. So just continuing to help policymakers understand that we need to find recurring sources of revenue or make annual appropriations to this really critical issue.
Right.
I just piggyback on what everyone said. I concur, but I think this is really the time to strike with regard to advocacy. We have a national attention on childcare and how it is connected to commerce and labor and the backbone of the economy, the workforce behind the workforce. And so in Maryland, I've spent a lot of time during this pandemic with media, because we tend to, media is something that you can, really impact leaders and the governor and the agencies that, you work with by sharing these kind of stories. And I also made sure that we connected through, for example, the Women's Legislative Caucus. Most states have something like that. This is a women's issue as well. Women are the one who typically don't go to work if they don't have childcare, the ones that lose the opportunities for career advancement because of childcare. And I think that we need to really bring to light the importance of the investments. We know all the brain development, we still bring that to light. Some legislators don't understand, or decision makers don't understand. I sent a PowerPoint of like 40 pages of things that, that I could share with all of you, that they'll be sent as resources.